Afternoon, folks. Appreciate you joining us again today. It's been a busy week. I will tell you candidly right off the bat, this has been both a frustrating and a discouraging week on two major fronts that we're going to focus on primarily today: police reform and the ongoing COVID crisis that we're seeing across the country, and particularly in the state of Alabama. I want to talk briefly about police reform right now. As you all saw, there was a vote yesterday. I have said all along that I believe the moment we are in this country right now requires some action. I think people are demanding that action. From Huntsville and Birmingham to Washington, D.C., we see it across this country. People are rising up and they're coming together to demand change. But it's got to be meaningful change. That is the important part of this. We've got to make real, tangible reforms and not just pay lip service to the movement that is going on throughout the country. Now, we had a vote this week. Senator Scott's bill on police reform was brought to the floor. I don't support Senator Scott's bill. I don't think it goes far enough at all to do what we need to do. I am a co-sponsor of the Harris-Booker bill, which I think is a much stronger bill and is the kind of action that is needed. But I did support calls for a bipartisan discussions, either in the Judiciary Committee or in an ad hoc committee that might be appointed by leadership to try to iron out these differences, to find the common ground that we need to go forward with significant police and law enforcement reform, just the same way we did with the CARES Act, to try to have these discussions before we get something to the floor that I was hoping we could get that would pass with bipartisan support. We've done it before. We could do it again. But as he often does, Senator McConnell rejected the calls for that bipartisan support. He chose instead to vote on a proposal that had only been introduced a week. It did not have bipartisan support. He had indicated he was not going to allow meaningful debate or an amendment process, and he knew that the vote was going to fail. In other words, he simply did this because he wanted to create a political narrative that Democrats are the ones preventing real solutions. And folks, I got to tell you, that is just not the case. So I held out hope on my vote. As you know, I was one of only two Democrats that voted to proceed to debate. I held out hope that we would get a debate, a real debate. If we had, it would have exposed the flaws, I think, in Senator Scott's bill. It would have exposed them to the American people. And then we could weigh in, and the American people could weigh in for strengthening that bill. You just cannot get the flaws out the bill to the public in dueling press conferences. And that's what we've seen over this issue, just simply dueling press conferences. Senator McConnell knows that, and that's why he was not likely to allow debate. That was the fear of many of my colleagues who voted to block the debate. And it's unfortunately why we are where we are today. I truly believe the American people want something done. They have a right to hear debate, and understanding the flaws of the current bill and try to make it better to move forward with something in a bipartisan basis. That is the debate I voted for. Unfortunately, McConnell wouldn't allow it, and that is a real shame. It is a shame that one man, one leader, has the power to deny debate, meaningful debate. So that's the debate I voted for, and I will continue to push for. I believe that folks on both sides of the aisle really want to move something, and I am hoping, and while I'm disappointed, I certainly hope that we're going to continue those discussions. I believe we're going to continue those discussions, and that hopefully we can get something back on the floor of the Senate sometime in the very near future and get something done on such an important issue. I want to move to the COVID situation, not only in Alabama, but across the country. As a nation, we peaked on April 24th at just over 39,000 cases that day. On June the 1st, our cases had declined to 17,000 cases. But here we are back now at the end of June with over 39,000 new cases just yesterday. 2 months ago, we had bent the curve. Today, it is trending sharply up. The states that had the most cases have seen the significant rise: Texas, Florida, California, Arizona, Georgia, North Carolina, South Carolina, Ohio, and Alabama. mostly southern states. And it is affecting not only our health, but it's also affecting the stock market. We saw another tumble yesterday. In Alabama, yesterday was our second highest day with over 1,000 cases. This continues to be a serious problem, folks. And if you look at where we are, and I won't run through all of the numbers, but they are pretty staggering. Where we were when we decided to open back up, which I supported, trying to open back up carefully and following the data before Memorial Day, and where we are now, we are still seeing deaths. We are still seeing more cases, and again, our 14-day averages are huge. Again, 1,000 cases just yesterday. We are not out of the woods at all, and we are getting into the July 4th holiday. We're getting towards school, and we have got to do a better job. That means wearing masks, it means social distancing, and trying to accept the personal responsibility for each other. I've recently talked to folks in the state today. I know that the governor is going to be doing some things next week, and the Alabama Department of Public Health is going to be rolling out some new tools so that people can better understand exactly where we are in Alabama. I think that has been a little bit of a problem, especially for local officials who do not see this in the same way as our public health officials do. I had a conversation with Don Williamson earlier today about hospitalizations, and that is a really troubling conversation. If you look at the week or so before Memorial Day, our hospitalizations were about 500 a day. 2 weeks after Memorial Day, it was over 600. This week, the week after that, it was 650. The point being that as we opened up and everybody got so loose on Memorial Day, we are seeing the spike in cases. We're seeing the spike in hospitalizations. The last 2 days was over 675. 82% of our ICU beds are being used at this time. Now, I think the hospitals will tell you people will get care. That is not the issue because they can convert other things. But the number of ICU beds used, the percentage of ICU beds being used is one of the markers to show how our healthcare system is getting stressed, because if we get over the number of ICU beds, they're going to have to start converting, and it's going to be less ICU beds for people with heart attacks and strokes and the other things that happen routinely in the course of our daily life. So the concern I think that we have here going forward is that just like Memorial Day, we're coming up on another holiday in another week. The July 4th holiday is also a time to get out, to play, to party, to have barbecues, to do those things similar to Memorial Day. And we have got to be careful because we are at a point now we can't afford to see the steep increase from where we are after July 4th, just like we saw steep increases after Memorial Day. So it is reason why I have asked Dr. Marrazzo to join us today. From UAB. She has been with me on this several times, but we felt like it was needed as we go into the July 4th, we really needed to focus on where we are right now, how significant this is, and what people can do for the July 4th holiday. I saw, a couple of, you guys may remember about a month or so ago, I cracked somewhat of a joke when I told folks that they should not travel to Georgia because of what was going on over there. Well, what we have seen in the last week is that certain states like New York and Connecticut and Kansas and others are saying, folks from Alabama, if you travel from Alabama, you're going to have to quarantine. That's where we as a state are right now, and I think that is really serious, and we need to be careful on what we're doing so that we can get this somewhat under control. Final thing before I turn it over to Dr. Marrazzo for a minute, I want to remind everyone, and I would ask the media to help with this, that the applications for the Paycheck Protection Program close on June 30th. For the businesses who have not made an application, please go. We will assist you in our office. If you need anything, just give us a call. But that closes on Tuesday, and we don't have another bill in sight right now. I'm hoping to get one, but there's not one in sight. So you may be out of luck if you don't get that application in by the 30th. So with that, I am so pleased to welcome back with us today Dr. Jeannie Marrazzo, the Director of the Infectious Diseases at the University of Alabama. She has been out front not only in Alabama but across the country with her expertise in this area. So Dr. Marrazzo, thank you for joining us again. I'd like to ask you real quick, if you would, in your opening comments, and maybe comment, I heard you today on national television talking about those orders from other states where people are saying they're going to quarantine or asking people to quarantine if they travel in from Alabama and a few other states. So if you could address that, and then I'll just turn it over to you. So thanks for being here.
Sure, Senator. Thanks, as always, so much for tackling this really challenging issue head on and for continuing to keep our focus on this unfolding tragedy. The situation recently is very much as the Senator outlined it. People have been, I think, increasingly alarmed that over the last 10 days, 2 weeks, we have continued to see marked increases in the number of cases reported. There was a lot of discussion early on when we saw that trend about whether or not that was simply a function of us getting better at testing. And indeed, we have been doing more outreach for testing, which has been a huge success and commitment. So that's great. The challenge is, as the Senator noted, we're also seeing increases in some other indices that are really alarming. And I'll just mention a couple of them, and I will come back to talk about that quarantine. First of all, the number of tests that are positive as a percentage of the tests that are done has continued to increase. So, for example, in Alabama, and in other states, we are looking at the average over the last 7 to 14 days. And that gives you a pretty good sense of what your baseline infection rate is in a given population. In Alabama, we had been running pretty much all along since this all started around 7%. We're now, for the last 7 days, up to 9%, and we've been as high as 10%. So we are clearly increasing. And in fact, that 10% threshold is what prompted this quarantine recommendation from the Northeast states that are now imposing a recommendation that people from states with a percent positivity for COVID-19 of all the tests done actually do not come to the state. And if they do come to the state, that they self-quarantine for 14 days. I will comment on that. I guess my feeling about that is that it is not something that's going to be easily enforced. It is not something that relies on the law. What it relies on is an honor system, and something we've been emphasizing unceasingly since this began. And that is that it really comes down to everyone's realization that we can change the trajectory of this epidemic. We really can do it at an individual level and at a societal level. So what the New York, Connecticut, New Jersey state governors are asking you to do is to recognize that because you're coming from a place with a high prevalence of infection, you are posing a threat. And you're not posing a threat to just any place. These are places that have been there, done that. They have experienced pretty devastating periods of really unimaginable loss. And as I said this morning on TV, it's really hard to imagine yourself in a situation like that until you're there. It's not us until it is us. And that's true for any major disaster, whether it's a hurricane or an earthquake or whatever you want to talk about. It is very easy to not think that it can happen to you. Well, we're here to tell you today that it can happen to us. And in fact, it's starting to happen to us. As Dr. Williamson discussed with Senator Jones this morning, we are approaching a critical threshold for our capacity to care for patients with COVID and with everything else that we need to provide care for over the coming weeks. As the Senator said, we will be able to care for you if you come to the hospital. But it may be that we have to look at some contingency measures to expand, for example, the places where we would normally put people in our usual intensive care units. I'll give you one example. In Houston, which is really seeing a very large increase. In fact, Texas this week reported more hospitalizations than it ever has for COVID, and the rate of hospitalizations has more than doubled since the beginning of this month. In Houston, they are starting to admit adult patients with COVID-19 to the pediatric or children's intensive care unit. That means that the pediatricians are having to step up and provide critical care to adults infected with COVID-19. Why? Because the adult ICUs are essentially filled to capacity. So we don't want to see that. My concern right now with the data, just returning to the overview that I mentioned, is that if we are seeing this very big peak in cases right now, the hospitalization and death rates, as we know, typically lag 2 to 2.5 to 3 weeks behind those case reports. So could we be seeing a situation in the middle of July, particularly with the July 4th weekend, people getting out and about, where we are in a situation like Houston is facing right now, or New York City, New Jersey, Boston, some of the other cities that have sustained really large burdens of inpatient demand have experienced in the past. And that is entirely possible. I really try to be reassuring. I want to be reassuring. We will find a way to take care of people, but we would rather do that with a set of providers, healthcare providers who are well rested, who have adequate facilities, who have adequate equipment, and who have adequate space. We do not want to be having people wait in the emergency department for beds because we don't have beds. So I think the points I would like to emphasize are that we do know how to do this. We did it in March and we did it in April. No one wants to go back to a societal lockdown for the reasons that the senator said. There are so many reasons we do need to get out. We need to get our kids back to school. We need to get people back to work. We need to get our economy functioning again. We can do that, but we just need to do it responsibly and in a way that doesn't make people's individual freedom feel compromised. Again, this really comes down to our collective, I think, responsibility. So the lockdown, quote unquote, worked very well. We don't want to go back to that, but we want to use these tools that we learned worked very well during that time. And what did work was using personal protective equipment for healthcare workers in the hospital, making sure they have an adequate supply of the best masks and gowns that we can get them, making sure that people did exercise physical distancing when they were not wearing masks. And if you are going to be close to someone within 6 feet, just wear a mask. You can do it just for that brief encounter, and then you can take it off. So we're not asking you to go around like healthcare workers are having to do and wear these masks for 12-hour shifts, which, as you can imagine, is very uncomfortable. So that's really the main message. I guess the last thing I would say is to really reassure people that we are working very closely, very hard on the behalf of the scientific community and you, population community, to try to identify new treatments, new diagnostic tests, and new prevention methods for COVID-19. As more people get sick, I'm hoping that more people have the opportunity to participate in some of these studies because we really desperately need more ways to treat the people who are sick. We don't have a pill right now for COVID-19. The only medication we have is given by vein, and that's not very practical given how many people we're seeing who we want to and hope to keep out of the hospital. Vaccine studies, we hope will start ramping up soon. I will be first in line to volunteer for that. And I really hope that in the coming months, we'll be getting more good news about those things. I do want to say one more thing. I apologize, Senator, for continuing to say that. I have one more thing to say, but I want to mention one thing that's been in the news a lot that I think this audience should know about, and that is that some of the newer data, particularly in Florida, are showing that while cases are increasing, the proportion of cases that are occurring in younger adults, those in their 20s and 30s, is making up a larger part of those infections. And that makes sense if you think about who's more likely to get out, who's more likely to feel good, who's more likely to want to be out in the mix. The challenge with that is that, remember, we've talked a lot about the fact that many of the infections that you are getting, people are transmitting, are coming from people before they develop their symptoms, or when their symptoms are really, really mild, or maybe they never get symptoms, but they still can transmit the virus. Younger people tend to have milder cases, less symptoms. They're not as likely to stay home. They may feel relatively okay, like they can go out and do their usual thing. That puts them at great risk for serving as an intense focus of transmission in the community. So lots of things to think about. Again, please take care of yourselves, and please help us to take care of our friends, our neighbors, our colleagues, and our families as we go forward. And I'll turn it back to you, Senator Jones.
Thanks, Dr. Marrazzo. I really appreciate that. I want to reiterate a couple of things. Number one, our state health official, our officer, Dr. Scott Harris, today, his quote was, he says that the only way we can change our numbers is with people making good personal decisions. It's something you can't just decide once, something you have to do all day, many times a day. I think that that's really good advice. The other thing I want to point out is that as we've opened up, we're also seeing, businesses, particularly some restaurants, who are having to close back down because someone on their staff has been infected and they've got to quarantine folks. And so, that as safe as I think our restaurants are being, no one is immune from this. And so the point being then, as we open back up, if we don't control this virus, our economy is going to go back down. There is no question about that. The stock market was down yesterday because on the news of the spike in cases. So if we want to get our economy rolling again, I think it's so important that businesses step up also. Churches, everyone step up on this mask wearing, and let's get everybody used to this and it not be such a political issue. It doesn't be such a social stigma issue. It's just something that we do, like buckling the seatbelts when we get in a car. So I think that's really important. I want to make sure that folks understand that everything we're doing is to try to protect lives and livelihoods. That is our mantra. That is what Dr. Marrazzo is doing. Everything we're doing is geared toward individuals, which then helps our economy. So with that, let's just kind of open some things up to some questions or comments from media. And I know we've got folks on Facebook. We may get to a few of those as well. So Heather?
Sure, we have nearly 24 questions from media, so we'll try to get to everybody today with the time that we have.
Okay.
The first question we have is from Brian Lyman with the Montgomery Advertiser. It's for Senator Jones. He asks, according to the Bama Tracker, Alabama's weekly average of new coronavirus cases has doubled since June 5th. Did state officials make a mistake lifting the restrictions imposed in April?
I don't think they made a mistake in lifting the restrictions. I've said this all along. I think Governor Ivey did a really fine job of trying to do that slowly. What I think we all underestimated, even though I've been saying it, Dr. Marrazzo's been saying it, Governor Ivey's been saying it, and others, I don't think people are listening to that personal responsibility part of that message. Remember, Governor Ivey's last order is still a safer at home order. And she tried to get the message out there to folks that we're going to try to open this up, but you got to do it safe. You've got to do it in a way that we follow the health data, wear your mask, social distance. And that's the thing people have just not listened and paid attention to. You go out anywhere in the state of Alabama and you see people acting as if the virus has gone away. And unfortunately, it has not. And I will say this, and I think it's important to say, I think you lead by example, and unfortunately what a lot of people are seeing on television with our federal leaders these days, they're not leading by example. And I think that gives a false message out there about where we are with this virus. So I'm hoping that people will start looking at the numbers and the health officials. As I said, I think there's going to be some new rollout of some tools next week with the Alabama Department of Public Health that'll help people fully understand where we are. If we can just do, as Dr. Marrazzo said, practice that personal responsibility, we're fine to try to open back up.
Our next question is for Dr. Marrazzo. It comes from Brendan Kirby with Fox 10 News and Mobile. COVID-19 cases have been rising for some time, yet deaths are declining. Are doctors getting better treating the illness, or is there some other explanation for that divergence?
That's a really great question, Brendan. And I think that there are a couple of points. First of all, are we confident saying that deaths are declining? Remember, deaths reflect the endpoint of a process that takes maybe between 3 to 5 weeks, depending on how the course of illness goes. So to say deaths are declining now may be related to what was happening with disease transmission, a month ago or so. So you got to be a little bit careful imputing the outcomes to the data that we have today, which is why I mentioned my concerns for July, given the increasing cases we have. That said, there is a possibility that one of the reasons we're not seeing as many deaths, at least in the last couple of weeks, is that, as I mentioned before, more of these cases are occurring in younger people whom we know, as I said, generally have not only milder cases of the disease, but certainly don't experience the same kind of mortality rates. Would that be a good thing? It would be a good thing because you're not seeing as many deaths. It would not be a good thing because you're still seeing that increase in the number of cases and the very substantial risk that those people who are infected are going to pass it on. So I think it's possible. We need to dig into the data a little bit more. And remember, we're still not in a perfect place where we're testing everybody who needs to be tested and where we're really understanding the relationship of who's positive and what happens to them as they go through the course of their illness.
I'd like to follow up on that from what Dr. Marrazzo said too, and this is just from me. Sometimes I think we focus too much just strictly on the deaths. This virus is a devastating virus for people. So many of the people that get it, they can't work, they can't do things, they can't be around their families. It is transmitted very easy. So I think even if we are seeing that decline, that we have to remember that this virus, just the community spreading this virus, can have a devastating effect on our personal health, our economy. And we don't know what the long-term effects of this are just yet. We've only been dealing with this about 6 months, so we don't know what the long-term effects are going to be for somebody who may have had this with some significant symptoms. I would also say this, just as we were here in this conference, I got a news alert that the CDC is now saying that the cases in the United States may be 10 times higher than reported based on the antibody work that they're doing. 10 times higher. And so that is a lot more devastating than I think people recognize. And if that's the case, then my guess is too, there's a lot of deaths that are going reported as something else and not necessarily COVID-related deaths. So this is really bad, and we shouldn't just continue to focus on the deaths. So thank you.
I could just add to that, Senator, back to the comment about younger patients. So yes, that can give us some reassurance, but I want to emphasize that the more cases you see, the more chance you have, or the higher chance you have of seeing uncommon outcomes. So we know that strokes, for example, devastating strokes have been reported in young patients. We know that young patients have died. So if we continue to see this ongoing spread within even a population or part of the population that seems somewhat protected from the worst aspects of the virus, we're going to see some very bad outcomes. And I agree with the senator, we do not know what the long-term effects are. Anybody you know who spent a month in the intensive care unit or several weeks on a ventilator, you know that it takes them a long time to recover if they ever do.
Okay, Heather?
This next question is from a number of different outlets, but I'll read the version from Tim Lockett with Anniston Star. It's for Dr. Marrazzo or Senator Jones. Health officials continue to tell us that mask wearing is one of the best ways to prevent the spread of the virus, though there's no statewide order requiring that. Should there be, and will Alabama law allow that?
Dr. Marrazzo, you want to take that first?
Sure, I'm happy to do that. I'm not a lawyer, and I'm not a person who could or would enforce the law. All I can tell you is that masks are probably one of the best tools we have to prevent the virus. Whether that is mandated by law, strongly recommended, required for entry into certain businesses, which I think is a great middle ground, although that does put the onus on the business and they should not be penalized for that. I think whatever it takes to get people to do it makes sense. Unfortunately, with a mandate, we have run into resistance and people don't want to be told what to do. And again, we are independent. That's one of the things that is great about us as Americans. We do have that streak where we don't really want to be told how to act or how to behave within a certain boundary. But this is different. This is really now time to think about what the cost of your not doing that is to your family, your friends, your neighbors. And as I keep on saying, the healthcare workers, we need to provide care to you when you get sick or if you get sick. If we don't have those healthcare workers lined up to take care of us, then we're really going to be in a bad place.
And I'll follow up real quick. Look, I hope we don't have to get to that. Perhaps under an emergency order, a mandatory mask could be required. But we've got different places in the state that are not as necessary as others. But the main thing is that personal responsibility. What I would like to ask the leadership in the state, and by leadership I mean not just the political leadership, the business leadership, the nonprofit leadership, the faith leadership, lead by example. Have folks in your businesses, in your churches, those that you're dealing with on a routine basis, lead by example and do this, because I think that is the biggest and best way for us to be able to get this under control. We need folks to step up and understand and be seen in public like I am. I have mine right here. I've got several that I swap back and forth. They're somewhat of a fashion statement in Washington, D.C. these days. So lead by example, and that it's truly our business leaders, I think, can step up more than they have been for their businesses and for them individually. I think our churches, you want to open, you want to get people into those places of worship, do so, but have them wear a mask. If they don't have one when they come in, offer them one. Those are the kind of things that I think we can do. The more people are seen out doing this, likely it is that everyone will do this, and they won't resist it as some sort of government mandate. But again, please don't listen to politicians coming out of Washington, D.C., including me. Watch what everybody else is doing. Listen to the health experts, because this is not a political issue. This is not red, blue, Republican, Democrat, or politics at all. This is about our health, your health, my health.
If I could just add something to that, I want to come back to something that was asked before, and that related to this concept of complacency, right? And people thinking that this was just going to go away. And I respect that opinion, because we have dealt with some scary viruses before. We've dealt with Zika, we've dealt with West Nile virus, and we've dealt with some scary influenza, and they've all seemed to fade away, right? I mean, they're a big problem. We talk about it, we worry about it, and then it's like, okay, now they're gone. I don't know that we can anticipate that with COVID-19. And I think it gets back to this issue of asking whether governments did the right thing by opening up. I do think most of them tried to do it very responsibly, but we really cannot underestimate this virus. To say it's apolitical is an understatement. It is a very, very, very crafty opponent, and it's really going to work its way around us. So really, really want to emphasize that, it's going to figure a way out in, if possible.
Next question is from Morgan Hightower with WBRC in Birmingham. It's for Dr. Marrazzo. New data released by IHME shows projections for total deaths, daily deaths, and infections for when the entire population wears masks versus not wearing masks. And there's a significant difference in the projections. If you've seen this, what is your reaction to this analysis? And do you believe it might persuade those who have chosen not to wear masks to start doing so?
Yeah, that's a great question, Morgan. And in fact, I was just on a call with the CDC last night where they showed some data that's available on their website, and they show projections for exactly what you're saying over time, comparing projected trends with or without mask use, not just from the IHME, but from a dozen other modeling groups that are looking at this. And what's really interesting about those data are that no matter who does the model, the difference between protection with mask use is really quite consistent. So they may all differ in the numbers of outcomes they're saying, number of deaths that are going to happen here, number of hospitalizations that are going to happen by this time, but uniformly across the board, mask use reduces most of those bad things by a considerable amount, sometimes half, sometimes about 25%. So I think we need to look at models cautiously. I always say it's important to recognize that they're not always right. In fact, I'll just say we modeled early in May that we'd have in Alabama right now 10,000 cases, and we have over 30,000 cases. So clearly our modeling left a lot to be desired. But I do think the models are compelling. More than that, the real world experience is compelling because, again, we have not seen healthcare workers get infected in hospital care settings where masks are absolutely required. And we have seen masks be a big part of the success when we were controlling this infection in some of the places we talked about before. So check out the CDC models. They're very interesting.
The next question is from Brian Lyman with the Montgomery Advertiser, and it's for Senator Jones. With Alabama and the rest of the South facing mounting caseloads, what role can the Senate play in trying to contain the outbreak? Would you support an economic relief package similar to what passed in March if lockdowns become necessary? And if not, what specific legislation would you support that could address the situation?
Well, I have supported additional legislation for the last 2 months. I think we should have been working on new legislation since we got back here on May the 4th, but we have not. Senator McConnell has not seen any urgency to do that, and I think that's a huge mistake because I think it's very clear now that we're going to have some additional help. Businesses are slow to open up, and rightly so. A lot of businesses are trying to do it carefully, which means there are still people that are not working. The payroll protection plan will run out. The unemployment benefits are going to run out, and people are still going to be unemployed or out of work. So I think there's a lot of things we should do. I think we should give hazard pay to those on the front lines. I think we've got to help the post office. I want to save the post office. I think we're just now beginning to see, and I've talked to a couple of our mayors, I think we're just now beginning to see the precipitous drop in revenue for our cities and our counties. They're going to need help just like our businesses have gotten help. And we have been slow to come around to do that. So I think we're going to need another economic package. I've said all along, Brian, that what we've done before is not a stimulus package. We've not done anything to actually stimulate the economy. We have just tried to save the economy. We've tried to save lives. We've tried to save livelihoods. And that's what we've got to continue to do. And as Dr. Marrazzo just said, this virus is going to be with us for a while. We are not out of the first wave. Everybody keeps talking about a surge or a second wave. You don't see a second wave if you don't get out of the first one. And we are still in that first one. And so we have got to continue to do what I think needs to be done from the federal government. That is going to require more money. Unfortunately, it is just the way it happens. States do not have the ability to do it. Cities and counties do not have the ability to finance that. Only the federal government can do it. So I am supportive of another package. You know, the House passed the HEROES bill, which was an additional $3 trillion. It's not a perfect bill by any stretch. There are a lot of things in there that I wouldn't support, but at least gives a framework for us to start talking about those things necessary. That includes, by the way, the same ramping up more money for ramping up testing, ramping up vaccine research, establishing a distribution system for a vaccine when we get it, or even the therapeutics when we can get it. The federal government has done a very poor job of distributing PPE, distributing testing. We have got to get that in place now, not in January, because then it will be too late and we will see a second surge. Remember, we got schools opening it up, and we're going to have influenza coming up in the fall and next year. And the convergence of all of that is not a good sign for the United States of America.
Next question is for Dr. Marrazzo, and it comes from Dennis Pillion from AL.com. Given the large increase in cases in Alabama over the last several days, does Alabama have the resources to do contact tracing and testing on the scale that is necessary to limit the spread of COVID-19? And is that an effective strategy for bringing our outbreak under control?
Great question, Dennis. I would say we do not have the resources at this time. You can imagine that with over 1,000 cases reported in one day, what it would look like to talk to each of those individual patients and ask them who they were exposed to in the last, even if you limited it to 7 days, and then go out and talk to those people. That would be a Herculean undertaking. That said, we need to develop those tools. We need to make sure we are poised to use them when we can. When we shift to a phase where we're dealing with fewer cases, more clustered cases, that is going to be an essential way to keep things down. So, for example, where New York is right now, Connecticut, New Jersey, they are rapidly scaling up contact tracing and isolation around cases. And that makes perfect sense because they're in a place where you've already made a big impact on this huge swell. I don't call it a wave, I call it a swell of underlying disease. And now they're sort of beating down the little cases or clusters that are coming up. We're not there yet. We might have been there in early March when this started showing up, but we're not there yet. That said, as I mentioned, we have to get ready to do it, and we have to train people to do it, and we have to train them to do it well and thoroughly, which is a challenge. But thanks for asking that question. It's important.
Goes back to the previous question. That is something that needs to be done from the federal government right now to give the states and local communities the resources to do that very, very thing. That is going to be important for businesses. It's going to be important for schools. And you can do it on a micro level if the federal government can give them the resources to do it. We are losing time on this right now. Every day that Senator McConnell doesn't let us bring that package to the floor of the Senate, we are losing valuable time in getting testing out there and getting contact tracing abilities out there to all our communities. And we need to get that done.
Next question comes from Brendan Kirby with Fox 10 News. It could be for Senator Jones or Dr. Marrazzo. Do you have any thoughts on the safety of students returning to school in the fall?
I'll take that first a little bit. I know that Dr. Mackey our state school superintendent, is very concerned about that, as is all of the local schools. And I think the short answer to that is yes, of course we've got some concern about that as we are going forward. And again, we put this all into perspective. You've got to figure out, look at what happened early in March and April, then what's happened post Memorial Day. And if we have a similar issue post July 4th, that is going to lead us right into the school year. And that is going to be a serious problem. The contact tracing is important. Testing is important. I know that every school is looking at this issue. The colleges are looking at it. K through 12 is looking at it. And it's just not the public school system and private school systems. Daycare centers are having to look at this in a serious way too, because daycare is so important for those people who are getting back into the job market and trying to get back to work. This is a multi-headed problem that we've got here, folks, and we've got to be very, very careful. So yes, there is some concern. I think the school systems are aware of it, but the problem is we've got to start planning now, not just through the school systems, but our own personal protection to try to get a handle on this so that we're not at 1,000 cases a day when these kids start going back to school, because they will get infected and they will have to have issues to deal with how they deal with infections at every school in every grade. Dr. Marrazzo?
If I could just add to that, thank you. One thing I think is helpful to do is flip that question on its head a little bit. So to get kids back in school, we need to have safe school environments. We need to make sure they're not going to get infected in school. And I'll talk about that in a minute. But what is equally important is making sure that the community is a safe environment, right? Because if they're not getting the infection in the community from all the ways that we know is happening or are happening, they're not going to be bringing it into the schools for spread clustering within the schools. So we need to pursue those things in parallel, which is why we're trying so hard to emphasize measures to get this big community surge under spread. I think if we could really get a handle on that again, I would feel much better about the prospect of getting people back in school in the fall. I agree with the senator. I mean, it's so essential, not just for parents and workers, but also for kids' developmental phase, right? They've really been disrupted. And imagine going through a whole year of your life when you're an 8 or 9-year-old and not having the experience of being around your peers. That's a really big deal. Much different for somebody like me, who's quite a lot older. But at that phase, it's a big deal. The other thing I will mention is that there are a number of groups, speaking of modeling, who are looking at the effect of some pretty interesting approaches to staggered school attendance. So there are some people that are talking about, could you go to school every other day, supplemented by an online telehealth or teleeducation effort on the intervening days? Could you do a 2 and 4 approach? Maybe, and they actually, the models look fairly promising. And the reason that they look promising is because you're essentially limiting the opportunity for spread of the virus to a smaller number of intensive time points. So it makes it easier to figure out when people are exposed. You can target your contact tracing a bit more, and you can also do more cautious opening up as time goes on. So I think look for some more detail on those models in the coming weeks as people get those out into the press.
Lauren Walsh with ABC 3340. It's for Dr. Marrazzo. She asks, what do you attribute the current surge of cases to? And a follow-up to that, more clinics are beginning to offer quick response tests. Do you encourage the public to use the tests, and what benefit could they have to help Alabama?
So I think the current surge, as we've talked about, is almost certainly because there has been a progressive increase in relaxation in the community's efforts to adhere to social distancing and masking practice. So when Memorial Day rolled around and people were really sort of feeling liberated, you did see, some of that, but that has only gone up, I would say, over time. So I think it's almost certainly a reflection of people mixing. One important thing to address is we don't think, for example, it's because the virus is mutating and becoming more infectious or more virulent or evil. The virus seems to be relatively stable for the most part. So this is almost certainly on us. We are giving the virus more of an opportunity to jump from one person to another, which is exactly what's happening. The second question was about the rapid diagnostic testing. The rapid diagnostic tests are not the most accurate. There have been some challenges with sensitivity, which is the likelihood that if you really have COVID-19, the test will turn out positive. So, I think it's okay. My concern is that you may get a false sense of security if the test comes up negative and it just didn't happen to detect you're positive. So my feeling is if you can get a test that is really sanctioned, being offered by the health department or by other providers where you know what you're getting, that would be optimal. I did want to return to one other question that I meant to address regarding reluctance to mask. I wanted to strongly call out and confront a rumor that I have been hearing, and that some have actually said doctors support, and I do not know any doctors that support this or who support this, and that's that wearing a mask increases your risk of getting a bacterial or viral infection. That is flat out not true. It does not increase your risk of getting any infections. What people might be getting confused with is the fact that if you are exposed to COVID, you touch someone who has it, you touch a cup that somebody just put down, who literally they just put in their mouth, etc., you rub your face or whatever, and then you touch your mask, get your hands on the inside, and then you put it down, and your hands happen to be dirty with COVID, then you are going to contaminate your mask. But please be aware, masks, when handled properly, when cleaned, should not pose any additional risk for COVID for sure, unless you contaminate it, and definitely not for any other respiratory infection.
Next question is from Brian Lyman with the Montgomery Advertiser. It's for both Senator Jones and Dr. Marrazzo. Based on the current state of the outbreak, should state officials consider returning to the more restrictive measures of March and April? Why or why not?
Well, I'm going to leave that to the governor. Again, I think what we really have to do at this point, rather than trying to go back to more restrictions, I think we've got to just re-up our game when it comes to education for people. And point out the examples. I think that's where both the state and leadership in Washington and everywhere else has probably let folks down, and that is, I'd like to see more of businesses, more leaders, more statewide leaders, more federal leaders, everyone else really up in the game and trying to educate people. If we can do that, I'm consistent that if we do that, we can continue to open up slowly, surely, and get our economy back. It's really the personal responsibility. Unfortunately, if things start to really go bad, then the states may not have a choice. I saw where the governor of Texas today has decided to delay some reopenings in the state of Texas because of concerns. And so, I hope we don't have to have the governor face that difficult choice, but it's going to require each of us.
Next question is from Lauren Walsh with ABC 3340. It's for Dr. Marrazzo. Where does UAB stand in terms of ICU beds and the ability to handle more COVID-19 patients?
All right. I see talking. Are we having trouble with Dr. Marrazzo?
They don't know what to do with it.
Okay. All right. Hey, Jeannie. Well, why don't you cut back to me or something? All right, so we are having some technical difficulties with Dr. Marrazzo's sound. I apologize for that. Jeannie, we're having some real technical difficulties. If you can hear me with your sound at this point, you sound like some demonic something right now. So we're going to try to fix that, and we'll get back to you in just a moment. So the question again, Heather?
Based on the current state of the outbreak, should state officials consider returning to the more restrictive measures?
Yeah, I think I answered that one. We'll move on.
Many of the questions are for Dr. Marrazzo, so we'll go back to those if we can get her. Eric Fleischauer with Decatur Daily sent in a question, not on COVID-19, but he's asking, students and some faculty at John C. Calhoun Community College in Decatur are pushing for a name change, noting that Calhoun is not from Alabama and his main legacy is defending slavery. It was built in the early 60s, and then Governor Wallace dedicated the building in 68. Senator Jones, do you support the renaming of the college? Do you worry about the message retaining the name sends to a new generation?
I'm not. The message is one thing, but I don't know why we would really want to name a community college for anybody that had not had a significant, either be from Alabama or not had a significant contribution to the state of Alabama. It's just that simple for me. I have said, though, and I said on an interview earlier today, I want us to be very careful because we can get caught up in removing names and things. What we really need to be doing is looking at removing barriers for health care, to break down the barriers that have created the inequalities in health care, inequalities in our system of justice, inequalities in economic development. Those are the kind of things that I think we need to be taking down. And so I don't want to get too distracted from removing too many names and things like this. And let's look at the systemic changes that we've got to make throughout society. That's, I think, the most important thing. But at the end of the day, I really think that things in Alabama need to be named after people from Alabama or someone who has had a significant contribution directly to the state of Alabama.
All right. The next question is from Lauren Walsh with ABC 3340. Eric Rudolph just filed a handwritten appeal in which he asks the court to resentence him to time served. What's your response to that, and can you tell us a little bit more about your work on his case?
Absolutely not. The guy is evil personified. He should not ever see the light of day, period. End of discussion. I was the United States Attorney for about 3 or 4 months when that bomb exploded. I killed a Birmingham police officer. I was one of the first ones on that scene. It was a horrific day. And we had to delay removing the police officer Sandy Sanderson's body for a couple of hours because we were afraid of secondary devices. Emily Lyons, the nurse, was gravely injured, and we were lucky that she survived. You had the Olympic Park bombing. There were so many things. I will say we were incredibly fortunate in being able to put that case together through the amazing work of a then young freshman at the University of Alabama in Birmingham who saw something wrong and tracked Rudolph across Red Mountain, enlisted the help of an attorney who was having breakfast at the McDonald's that used to exist there. And but for those two guys, I don't know if we would have ever caught him. He would have certainly killed again. And I, as the former prosecutor who was involved in that case, if asked, I would adamantly oppose any release of Eric Rudolph, because he will kill and again and again if let out and given that opportunity.
All right. While we're still working on getting Dr. Marrazzo back with us, I'll ask a couple of Facebook Live viewer questions. Kala Hamilton asks, what help can you offer the child care centers we are operating now? Everyone's focused on the K-12 schools, but what about people who are keeping the kids so the world can operate?
Yeah, I alluded to that a minute ago, Carl, and it is something that we're looking at from here. We are trying to figure that out the best way we can. Certainly the daycare centers are even more important now, because as we open up the economy and there are working parents that need those centers to help them. We've got to make sure that you've got the resources to use the proper social distancing and limit the number of kids that come in there. That is going to be more expenses for you. We are trying to get, and I know there has been money for daycare centers and child care centers across the board. We hope to get more coming out in this next package. Again, if I can ever get, I say the Senate can ever get Senator McConnell to start talking about it and put it on the floor of the Senate. But I can assure you, I'm a member of the Health, Education, Labor, Pensions Committee, HELP, and that has been a priority. We had an entire hearing about child care and what it's going to take coming up. So it is front and center for our concerns in the next package. We got Jeannie back online?
Yes, just now. Sorry
Awesome.
about that.
Awesome.
I'm not sure what was going on. Sorry.
All right. We have a few more questions for Dr. Marrazzo, so I'll get to those. Lauren Walsh with ABC 3340 had asked, and this is, I think, where we lost you. Where does UAB stand in terms of ICU beds and the ability to handle more COVID-19 patients?
Yeah, so UAB thankfully has been really stable since April or so. That's good and bad. Although in the last week we have seen a small increase. So we have about 70 patients in-house right now. We typically have hovered between 50 and 65. So we have seen a small increase. The trajectory is slowly climbing. Again, I think we're okay, but my concern is going to be in the next couple of weeks when we may see the tail end of the peak in cases that we're seeing now.
Jeannie, I cannot follow up on something related. How do we stand on PPE, personal protection equipment? That's always been an issue. Where do we stand on that UAB-wise, and if you know about that statewide?
I think, we are okay. I don't think we can be comfortable. We have calculated the days on hand for the various components of PPE, including masks, gowns, hand sanitizer, gloves, and they all differ as things come in. We're still sterilizing N95 masks for healthcare workers. So when I was seeing patients in May, I would drop my little N95 off at night as I left, come back and get it in the morning in its little plastic bag, and I would use it again for another day. So I don't think we can be comfortable. It's not as scary as it was back in March when we were really worried about it. We've had a little bit of time to get things up and running, but I think it's something we have to carefully keep our eye on. The thing I was going to address before I think I got cut off, I'm not sure if you heard me, related, and I think it was also Lauren's question about should we shut down again. I don't think we can, because shutting down in the way that we did in March and April was like doing a sprint, right? We are now in a marathon. This is not going to go away anytime soon. So we've got to figure out ways to work through this that do not cripple us socially, economically, psychologically, and emotionally. So that's really why we do need to talk about some of these measures we've been emphasizing today.
Next question is from Marcus Stroud with CBS 42. Birmingham, Alabama has multiple restaurants that are closing because of COVID exposures and positive cases. Should we go back to curbside service only? Even if we do that, is it enough to protect the restaurant employees?
Jeannie, you want to take that one?
Sure, I'm happy to address that. Yeah, the curbside service has worked well, and to our knowledge, there have not been outbreaks related to that, which is great. The challenge with curbside service is I'm not sure that's really enough to economically sustain several of the places that we're talking about. Now, if isolated infections occurring in these establishments are part of the price of opening, we may have to accept that, but what we have to develop if we're going to accept that is a way for dealing with them that doesn't throw things into unpredictable chaos. So that's coming back to that concept of contact tracing and isolation. If you have a system set up and you've managed to get that surge down to a manageable level, you should be able to quickly swoop in with your contact isolation team, your COVID management outbreak team, and extract that worker, really look carefully at who's they've been in contact with, and either close the restaurant if you have to, or figure out a contingency plan. And I think we're probably going to get more creative with that as time goes on. But we do need to have plans in place to do that as places open up, because we found exactly what happened in the last couple of weeks. We're going to see this stuttering, opening, closing, and that's not very good for people who are going to the restaurants, or certainly for the people who are running them.
And if I could follow up on that, again, going back to the bill that we haven't seen yet to help with this next package. Senator Warner and other senators and I have a package called the Paycheck Security Program that would allow restaurants and all like that, when they do see those problems, to continue to keep their employees on staff and employed with their benefits, and allow them to slowly get back to a point that at one point they can open up fully. But we've got to help. That's exactly the reason why it's important to get another package and get it in place soon, so that we're not trying to deal with that in August and September, and these businesses are going to suffer because they are on thin ice and they could easily go under if we don't provide that help to them. So, okay, that's it. Dr. Marrazzo, thank you again. I'm going to give you a couple of minutes if you'd like to finalize here. I really appreciate your being with us again.
Sure. I think we've really hit all the really important points. The responsibility for us to take care of each other, to take care of our healthcare workers. The one thing we didn't mention that I want to make sure we touch on is the fact that we are seeing marked disparities in who is most vulnerable to COVID-19. So if you look at the population of people in our ICUs or in the ICUs in Montgomery, there is a definite preponderance of Black Americans in that situation. And we know from other cities that Black Americans have suffered a disproportionate number of deaths from this infection relative to the percentage of the population that they make up. And we don't understand why that is. We do know that people with underlying conditions, particularly hypertension, heart disease, lung disease, are definitely more likely, diabetes, obesity, definitely more likely to do worse with COVID. So we really need to keep our eye on this and remember that advocating for healthcare for vulnerable populations who may not have the best access to preventive healthcare, in particular to address those underlying conditions, is really critical. And that's really important for Alabamians to remember. Thank you, Senator. Thank
you, Dr. Marrazzo. And I'd like to follow up on that real quick. Everyone on this call has heard me consistently talk about expanding Medicaid, where I'm still going to try to get something in this next package to expand Medicaid. The disparities in our state are striking, and this pandemic has really put a spotlight on those disparities. We have to do more. And it is ironic that today the Department of Justice of the United States is filing a brief in the Supreme Court to try to end the ACA, the Affordable Care Act, at the very time when we need it the most. The Department of Justice and the state of Alabama is involved in that lawsuit as well, and it's just wrong. We need to be working to expand all aspects of our health care, expand Medicaid, and get access to good quality health care across the board, regardless of zip code. That's how you save lives. It's how you save livelihoods. It's how you save the economy. It's how you decrease the disparities that we see across the country. So with that, I want to thank everybody for joining us. If you have any follow-up questions, please get in touch with Heather. We will try to do this again about this time, hopefully next week. So thanks for being with us, and thank you, Dr. Marrazzo.